Hello, I'm Logan Nestor, Director of Communications and Public Relations for Mount Rogers Community Services. Have the exciting opportunity to speak with a pharmacist about the COVID vaccination and some questions that a lot of people have about the COVID vaccination. Justin, if you want to introduce yourself.
Hey everybody, my name is Justin. I'm one of the pharmacists with Genoa Healthcare. I'm actually located inside the Lisa Moore Counseling Center in Marion with Mount Rogers. So grateful to have the opportunity to talk with you all.
All right, thanks, Justin. And we'll just get straight into some of these questions about the COVID vaccine. Since this is such a new thing, people have only been getting this for 4 or 6 weeks at this point. As a pharmacist, do you feel that this vaccine is safe?
Definitely, that's a great question on everybody's mind. So I think it's important to know that all of these vaccines that are available to us, the two currently on the market, they've been through rigorous testing to make sure that they're as safe as possible. They've actually been through this process about a year now. The virus was isolated late 2019, went through creation of the vaccine, then through clinical trials, including about 30,000 participants, to get us to the point today of having these vaccines available. So really a year has gone by where the FDA has reviewed this data. They've issued the emergency use authorization because the data showed that they met safety criteria and that efficacy in fighting the vaccine or the virus was shown. So the benefits are definitely known to outweigh the known risks of contracting COVID-19. Just something to note maybe, the two vaccines that are available, they do not contain any eggs, latex, preservatives for anybody who has any allergy concerns. It is urged, though, if you do have any type of history with anaphylactic reactions, so difficulty breathing, facial swelling, you would want to consult with your physician maybe before receiving this vaccine.
And, anyone who's watched the news in the past 6 to 12 months has heard the term mRNA or messenger RNA. What is that, and how does that make this vaccine different from maybe other vaccines that we've all received in the past?
Right, so mRNA, definitely a popular term, and the two vaccines that are available use this technology. Important to know that this is a new vaccine, yes, however, the technology has been studied for many, many years now going on. It was really kind of a perfect storm with this because mRNA allows us to produce vaccines in labs with readily available materials, giving us the ability to ramp up production, ideal for a pandemic. So this kind of suited well for this purpose. mRNA vaccines, so messenger RNA, what they're doing, they're giving our bodies instructions to make a harmless spike protein that's found on the surface of the virus, which causes COVID-19. Once our bodies produce that, it identifies, hey, this protein shouldn't be there. So it immediately begins the immune response to destroy it. The body then remembers this process so that it can help us fight off any future infections if it's the actual COVID-19 virus is detected. An important note that you probably hear maybe from spectators is that it will not alter your DNA. Doesn't have the capability of crossing the cell's nucleus, which contains your DNA.
And you already mentioned the two different vaccines that are widely available right now, the Moderna and the Pfizer vaccine. Is there any real difference that someone should be concerned about if they're going to go get vaccinated? Are there any difference we should know about between Moderna and Pfizer?
So the two are both using the same mRNA technology that we talked about. They have basically identical side effect profiles. The only real difference that a consumer would see getting these vaccines is the time frame that you would return for your second dose. With the Pfizer vaccine, they want you to return in 21 days, and with Moderna, it's 28. You may find yourself in a situation, or if you're going to get the vaccine, that only one is available to you. I certainly would not let a brand deter you from getting the vaccine.
And you mentioned the length of time between the two doses. Why exactly, for both of these vaccines, do we need two separate doses?
So with the current studies, the two show the highest efficacy with the second dose. So we obviously want these vaccines to work at their highest potential, which is why the two doses are required. It's important to receive the second dose as close to schedule as possible. However, there's not a maximum interval, so just be sure to get that second dose. And it's also important to note that when you receive your first dose, your second dose should be of the same manufacturer that you did receive prior.
How long does it take before the vaccine is effective and, this mRNA gives our body a better ability to fight the COVID virus?
So even studies are showing positive results even with the first dose. However, what you've seen advertised in the news that these vaccines provide roughly 95% efficacy, that is occurring after your second dose. The total time frame from first dose is going to be about 5 to 6 weeks. So roughly 1 to 2 weeks after your second dose is when you're going to see that full efficacy.
All right, and what are some of the most common side effects?
So commonly you're going to see pain, swelling at the injection site. You may also experience fever, chills, headache, fatigue, also experienced across the body, but they should be going away in a few days. These experiences are actually a good sign. Typically, it's showing that the immune system is responding. It's important to definitely remember to get that second dose, even if you do experience these type of side effects. I know in my experience, I've already completed the series. My first dose, I just had injection site pain. With my second dose, I did experience injection site pain paired with fever, chills that started about 12 hours into the dose and lasted for probably another 12 hours.
All right, and if a person has already had COVID, should they get vaccinated?
They should still definitely consider getting the COVID vaccine, even if you've previously contracted it. We really don't know enough information to tell us how long we have this immunity, and reinfection is certainly a possibility.
All right. And if a person is fully vaccinated with both doses, can they still pass on the virus?
So, talking back to our clinical trials, making this as safe a vaccine as possible, safety was top priority. So, due to this, transmission after receiving the vaccine really hasn't been fully studied at this time. So, we really don't have enough information to say. So, experts are taking the time to better understand that. So, in the meantime, we really need to still be vigilant with our mask wearing, hand washing in order to protect ourselves and others who may not have received the vaccine yet.
What are some good, reliable, pharmacist approved sources to get some more information about this vaccine if someone has further questions?
Great question. Yes, so there's so much information out there. Unfortunately, a lot of it is misinformation. You definitely want to avoid social media, but I really, really like cdc.gov. This has a really well organized website for basically any information you would want surrounding the COVID vaccines. And I also really like the Virginia Department of Health website. This is going to give you the information to let you know what phase we're in and when you would be eligible to receive it.
All right. And you work for Genoa Pharmacy, which is, very closely tied to Mount Rogers and especially our Lisa Moore Counseling Center. At any point, is Genoa planning on getting vaccines, giving vaccinations? Can you tell us anything about that?
Definitely. We are in process of hopefully receiving our first arrival of COVID vaccine within upcoming weeks. So we can definitely keep you all posted on that. And anyone interested can certainly reach out to us here at our phone. I'll give you that. It's 276-378-7862 here at Lisa Moore Counseling Center.
All right. Well, thanks, Justin. I appreciate you giving us some of your time. I think some good information from a pharmacist is something that we can all use right now. So I really appreciate you taking a little time out of your day.
Glad to be here. Thank you all. Stay well.